At Rewind Anti-Aging, one of the questions that our clients frequently ask when they're on our testosterone therapy program is how do they properly mix the syringe and needle for the testosterone itself. Testosterone is suspended in oil, so it's a little bit thick. So what we do to help our clients with the preparation and injection of the testosterone is we send a needle which is a little bit thicker. It's called a draw needle, and then we have what's called an inject needle. So what we do, this is the testosterone. You always, prior to extracting the testosterone, you take an alcohol wipe and you want to thoroughly clean the top of the vial. You then take the syringe and needle combination. I always make sure that the needle is on tightly, and you basically come in and you draw the appropriate amount into the syringe. You want to try to get as much air out as possible. And once you've accomplished that, you pull the needle and syringe back. I then create a little air gap by pulling the plunger back. You want to always recap your needle for a safety precaution. You then take your inject needle and you then screw that onto the top of the syringe, and now you're ready to go. Prior to injecting, you always want to get rid of the air bubble which is in the top of the syringe. So what we do is just press out, and there you see a drop or two of the testosterone come out, and now you're ready to inject. As I said, oftentimes many of our clients have a question of how to prepare this the right way, so we wanted to provide them with this instructional video so that they don't have any questions. Hopefully you'll tune into our channel in the future, because we're going to be going over all of the products we use in our HRT practice and how to prepare each of them. Thanks for joining us. We'll speak to you soon.